Okay, so we're going to go ahead and do our final complete health assessment today. We're going to come in and provide adequate lighting. We're going to make sure that we do hand hygiene and we gather our appropriate equipment. For this examination, we will be using an otoscope, which I have, a stethoscope, a tongue depressor. We will be using a white sheet of paper to perform the cover test, as well as half of a Q-tip to perform the sensation portion of the examination. We'll be using a pen light for the eye examination, and we will be using a hammer both ends as well. Okay, so we're going to go ahead and get started. We've come into the patient and provided privacy. We've used hand hygiene. As the patient is sitting down, we're going to be looking for any physical deformities, noting hygiene, making sure the patient is dressed appropriately for this time of season. We're going to be looking at his range and range of motion and his gait, making sure that there are no involuntary movements and that he doesn't have any troubles with his gait as well. Okay, so once we have examined all of those things, we're going to go ahead and get started with the level of consciousness as well as his orientation. So, Mr. Chaffin, do you know where you are today?
Yeah.
Where are you at?
My apartment.
Okay, and do you know what year it is?
Yes.
What year is it?
2013.
Okay, and can you tell me the President of the United States?
Barack Obama.
Okay, thank you very much. Okay, and next we're going to go ahead and we're going to look at his skin, his overall skin appearance, making sure that his skin is pink and dry and warm throughout his extremities as well as his head and face. We will also be looking at his affect, to make sure that he is engaged with the examination. We will be looking at speech, making sure he has no difficulty communicating with me, checking his hearing, making sure that he is able to follow commands when I instruct them. So that's what we'll be looking at. And he does not have any speech difficulties, nor does he have any hearing abnormalities either. Okay, and his nutritional status appears to be healthy. All right, so we're going to next start with the head. We're going to palpate the scalp, making sure that there are no lesions, there's no tenderness, there's no masses or bruising that he can sense. Okay? And then we're going to feel back into the occipital lobe, making sure that we feel the lobes. And we're feeling for the roundness of the cranium, making sure that there are no asymmetry concerns of any kind. We'll be looking at the hair as well, noting in for any alopecia, any hairline reduction, and we will be looking at the hair on his face as well, making sure that it corresponds to his hair color as well. Okay, and so after that, we're going to be looking at his face. We're going to be examining his sinuses. I'm going to go ahead and apply pressure here at the top. And I'm applying pressure to the top of the eyebrows. Okay, and tell me if you feel any pressure. And I'm going to move down below the eyes, palpating lightly. Do you know any pressure at all, any tenderness? No? Okay. And then we're going to continue on and we're going to locate the temporal artery. And once we've located the temporal artery, we're going to feel for strong and equal pulsations bilaterally. Okay, and then after that, we're going to continue on to the temporal mandibular joint. I'm going to have the patient open and close his mouth for me. Go ahead and open and close your mouth. And close. Okay, thank you. And we're going, with this, we are examining the range of motion with his temporal mandibular joint, making sure that we feel the joint contract as well as open. Okay, and then we're going to be looking at the patient's eyes, and that'll be the next part of our examination. I'm going to look at the overall appearance of his eyes, looking at the eyebrows, looking at the eyelashes, making sure that they are well distributed, and that they are even. We will be looking first at we're going to be looking at the conjunctiva, the sclera, the iris, and the cornea. The sclera should be white. If we want to, we can pull down the conjunctiva slightly, and that should be pink. We don't want to see any redness, swelling, any discharge coming from the eye. The sclera should be white. The cornea should be clear. We would look at that from the angle, making sure that there are no foreign bodies. We want to make sure that his iris color is the same as the eye color that he was born with as well. And we would be looking at his pupils, noting the pupil size. Brock appears to be roughly a 2. So we will be looking at those, making sure that there are no concerns of any kind. We're going to go ahead, if we had a Snellen chart, we would have the patient stand up and stand about 20 feet away from the chart. Having the chart on the wall, the chart would start with large letters and they would get smaller as the levels go down. I would have Mr. Chaffin cover one eye, and read the Snellen chart from the top all the way down. This would result in a 20/20 vision, which Mr. Chaffin has previously conducted, and he does have a 20/20 vision. Note that this Snellen chart exercise would be done with both eyes. Okay, so next we're going to go ahead and test his peripheral vision. So I'm just going to go ahead and put my hands behind you, and you tell me when you can see my fingers, okay?
Yeah. Yes.
Okay.
Yeah.
Okay, and so that tests his peripheral vision. Next, we're going to conduct the 6 cardinal stages of gaze. So I'm just going to go ahead and move my finger, and you can just follow it, okay? Okay, and Mr. Chaffin is able to follow my eyes without any abnormalities, any eye crossing, so he is doing just fine. So next we will be doing the cover test. I'm going to take this piece of paper and you're going to cover one eye and you're going to follow my finger, okay? All right. And you can just hold that up to your one eye, okay? And I want you to go ahead and follow my finger. Okay, and you can go ahead and switch eyes and follow my finger. Okay, and I'll go ahead and take that. This test to make sure that with one eye he's able to follow my finger, and with the other eye he's able to independently follow my finger as well. So the eye should not be crossing, and the eye should be able to follow the finger. Okay. So next we're going to go ahead and get started with the ear portion of the examination. We're going to be looking at the external part of the ear, noting for any bruising, lesions, tenderness, any masses of any kind. We're going to go ahead and manipulate the ear, feeling at the pinna, making sure that it has maintained its elasticity and that there is no tenderness upon manipulation. Okay? And we're going to do this on both ears. Throughout this examination, I might be doing one ear, one eye, one arm, but that is just to make the examination slightly quicker. But in this examination, you would want to do both arms, both eyes, both ears, examine each side and compare each side from the other, okay? So we're going to go ahead and we're going to take our otoscope and we're going to advance it into the patient's ear. We're going to be looking for any discharge, any redness, swelling, discoloration of any kind. We'll also be looking at the canal, noting those things as well. And then finally we'll be looking at the tympanic membrane, making sure that it should be a glossy gray pearly color. Okay, so I'm just going to go ahead and I'm going to advance this into your ear. We want to make sure not to advance it too harshly, and we don't want to abrase the canal and cause injury to the patient's ear. Okay, so we're just going to advance it and note that we do not see any discharge and that the tympanic membrane is a glossy pearly gray texture. Okay, so next we're going to be testing the patient's hearing. So I'm going to occlude one of the patient's ears and I'm going to whisper a 2-syllable word and the patient will repeat it, okay? So I'm going to go ahead and whisper a 2-syllable word and you can just repeat it. Baseball.
Baseball.
Apple.
Apple.
Okay, excellent. All right, and from this we're just going to continue on to the nose portion of the examination. and using the same tools that I've used before, I'm going to be using the otoscope. I'm going to have the patient tilt his head back slightly, and I'm going to be examining the mucus, the mucus, the septum, and the turbinate. Okay. And we want to make sure that the turbinates are pink, they're not swollen, they're not reddened, there's no lesions of any kind, nor masses. We want to make sure that the mucus is clear, there's no abnormal discharge, and we want to make sure that the septum is aligned. At this time, Mr. Chaffin does have a deviated septum, so that can also cause trouble in breathing in and out through the nose. So I'm just going to go ahead and before you actually start examining the nose, you're going to look at its symmetry, making sure that it's symmetrical and even. We're going to test the patency of Mr. Chaffin's nasal pathways. So I'm just going to have you occlude one side of your nose and breathe in and out. Okay, and can you occlude the other side and breathe in and out? All right, excellent. Thank you very much. All right, and so next we're going to be examining the oral area of Mr. Chaffin's mouth. We will first be looking at the overall general appearance of his lips, noticing for any cracking, any discoloration around the lips or on the lips. Once we have examined that and noted that, we will be examining the inner part of the oral cavity. So I'm just going to go ahead and shine my light. And I'm going to be looking at the teeth, we're going to be looking at the uvula, we're going to be looking at the palate, the gums, the buccal mucosa, the tongue, and the overall aspect of the oral cavity, okay? So go ahead and open your mouth for me. Okay, can you say ah? Okay, and this allows me to look at the uvula, making sure that it's midline. Sometimes in stroke patients it might not be, or it might deviate to one side. We want to go ahead and grade the tonsils, as well as locate the tonsils, and Mr. Chaffin has a grade 2 of tonsils. We are able to see them with the pillars as well. We can note the teeth and noticing any dental work that has been done, asking for possible, if they have dentures in, they would want to remove them. Before I continue on, I would like to go back to the eyes, and we're going to be testing for light reflexes, making sure that the pupils are equal, round, and reactive to light. So what I'm going to do is I'm going to shine the light in Mr. Chaffin's eyes, and we're going to be looking at the constriction and dilation of the pupils. Okay, so I'm just going to go ahead and shine this light into your eyes. Okay, and I'm going to shine it again, and now we're looking at the other pupil. Okay, and we would want to do this in both eyes as well. All right, and so next, after we have examined the mouth, we're going to continue on with the neck. We're going to be looking at the neck, and we're going to be palpating. Oh, I'm sorry. I apologize. We're going to be testing cranial nerve function just before we continue on to palpating the neck. This allows me to determine if there are different cranial nerves that are malfunctioning, or if there might have been some dysfunction earlier as a child. So we are going to go ahead and examine those. I'm going to take a tongue depressor, and I'm going to test Mr. Chaffin's gag reflex. I would advance the tongue depressor far back until I received a gag reflex from Mr. Chaffin, and that would test cranial nerve function. So we're going to go ahead and do that. Okay, and we do have a gag reflex, so that is a positive indication that no damage has occurred. Next, I'm just gonna have you stick out your tongue. Okay, and then this also tests for cranial nerve function, also in a stroke patient. The tongue might deviate to one side or the other due to cranial nerve injury. All right, next we're going to be palpating the neck. Before I turn around and get started from behind the patient, I'm going to locate the lymph nodes, noting for any swelling, any abnormal masses. Okay, and then I'm going ahead and getting behind the patient. And this way I'm going to locate the thyroid. And behind that we're going to locate the trachea, and then behind that we would locate the thyroid. Okay. Noticing any swelling, any abnormal masses of any kind. Okay, and then next we're going to test the neck range of motion as well as the strength of the neck as well. So we would then have the patient go ahead and push up against my hand. Okay, push up against my hand, push up against my hand, and push up against my hand. Excellent, thank you. This tests the strength of the neck. Next we'll be doing the range of motion of the neck. So Mr. Chaffin, what I'm going to have you do is I'm just going to have you bend your neck from one side to the other, and go ahead and bend it forward, and bend it back. Okay, and bend it back again. Okay, and we're going to notice any difficulty, any straining on bending the neck as well. Okay, and then after we have conducted our portion on the neck, we're going to continue on with the chest. We're going to be looking at the overall appearance of the chest. We're going to be looking at muscle symmetry, and we're also going to be checking for the carotid pulse and making sure that it is even, strong, and equal bilaterally. So I'm just going to go ahead and palpate your carotid pulse real quick. Okay, and they are equal and strong bilaterally. So with the beginning of the chest, we're going to, as I said prior, we're going to be looking at the overall symmetry of the chest. We're going to be looking at evenness when the patient breathes in and out. I'm going to go ahead and first place my hands on the chest, making sure that when the patient breathes in, bilaterally, each lobe is equal when he inhales, and when he exhales, both my hands come in and out at the same time. So go ahead and inhale for me. And one more time. And this test for symmetric expansion and inhalation. We also note that with Mr. Chaffin specifically, his thoracic area is rather wide, and he does present with what we call a barrel chest. So his thoracic cage is a rather wide area, as opposed to a normal statued physique of a male. So then we're going to go ahead and we're going to be listening in all quadrants for clear breath sounds. So we're going to, before we get started, we're going to start with the tactile fremitus. And what this does is that he's going to say a word or say a phrase, and I'm going to monitor his vibrations in his muscles through the feeling of my hands. So that is what we will be doing next. Okay, so what I'm going to have you do is say 99. Every time I touch you, you can say 99, and I'm just going to feel for vibrations, okay?
99, 99, 99, 99.
Okay, and then I'm going to do bilaterally as well. So go ahead.
99, 99, 99.
Okay, excellent. Thank you very much. And so next we're going to go ahead and we're going to be listening to the patient's lung sounds. What this is called is bronchophony and egophony. And so what I'm going to have him do is say a number or a phrase, and I should actually be able to hear a muffled version of that phrase from the posterior lung sounds, okay? So, Brock, what I'm going to have you do is I'm just going to have you say 99 again, so every time my stethoscope touches you, you can say 99, okay?
99, 99, 99, 99, 99, 99.
And can you lead forward for me?
99, 99.
All right. And so I was able to hear a muffled version of 99 when Mr. Chaffin was saying that phrase. Next, we're going to be doing agophony, and I should be listening for the same thing when he hears E. It should be higher pitched, though. Okay. So go ahead and say E whenever my stethoscope touches you.
E, 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 E,
Lean forward.
E, E.
All right, excellent. And I was also able to hear that as well, but it was a muffled version. Next, we're going to do percussing, and what we're going to be doing is just tapping the inner 1/3 of my finger, and we're going to be listening for thug sounds, differentiating between hitting bone and hitting empty space. Okay. All right, and so that's an example of that as well. Okay, and then next we'll go ahead and get started on your upper extremities. Before we move on, we want to make sure that we don't want to miss looking at his overall appearance of his chest, looking for any tenderness, masses, any lesions, any bruising as well, just as we would with any other part of this examination and any other part of the body. We would also want to listen anteriorly and posteriorly for clear breath sounds, listening in all quadrants of that as well, and coming around and listening to the lower lobes of the lungs as well. Okay, so next we're going to get started on the upper extremities. With this, I do apologize. We're going to listen to the heart next. We're going to be looking at the overall chest cavity again. We're going to be listening for the different quadrants of the heart. First, we're going to be listening for the apical, the pulmonic, the tricuspid, and the mitral valve. The mitral valve, which we will be listening for 1 minute, noticing the rate and rhythm of the pattern of the heart as well. Okay. Okay, and we would listen for a whole minute for that heart, and note that rate and rhythm, making sure that it is an accurate and even rhythm. I want to mention that when listening to the lungs and listening to the heart, you are comparing rates and rhythms from one side to the other, no matter any time that you listen for them. You're always comparing one side with the other. Okay, so next we're going to get started on the upper extremities. We're going to be looking for any masses, any muscle weakness, any tenderness, possibly any edema. And so we're going to be testing for strength exercises as well as range of motion. Okay, so I'm just going to go ahead and I'm just going to lift your arms up. Okay, and can you move them all the way back in a circular motion and back to your lap? Okay? And can you do that with the other arm as well? Okay, and I'm just going to go ahead and have you squeeze my fingers and squeeze them as hard as you can. Alright, and then I'm going to move up, and then across, and then back down. Alright, and then that's going to test his range of motion and his upper extremities, as well as his strength in his hands. And so next I'm just going to go ahead and I'm going to be assessing the arms and the shoulders and testing the range of motion with those. When my patient did move his arms, that tested his shoulders as well as his arms. Next, I'm just going to go ahead and examine your wrists real quick. If you could just move them back and forth. Okay, and then go ahead and make fists. And then I'm going to push your hands down, and you're going to resist. Okay, I'm going to pull your hands up, and you're going to resist. Okay, excellent. Next, we're going to be looking at the abdomen. So for this examination, I'm going to have the patient lie down on the table, and I'm going to be assessing his abdomen. So we'll go ahead and get started with that. Mr. Chaffin, if you could go ahead and just lay down on the table. Okay, and so when we're examining the abdomen of a patient, we're going to be assessing the symmetry of the abdomen, the color, any changes in pigmentation. We're going to be looking at the contour, making sure there are no distensions, noticing for any ascites or any concerns of that. So that's what we'll be doing, okay? All right, Mr. Chaffin, I'm just going to go ahead and lift your shirt up, okay? And I'm going to be looking for all of these things that I have previously stated. We're also going to be palpating and auscultating in all 4 quadrants as well. So we're going to go ahead and overall inspect the area of the abdomen. Okay, and we're going to be looking for breath sounds, but also within that we're going to be looking for pulsation. We're going to be looking at the umbilicus as well, making sure that there are no possible herniation concerns or anything such as that. Okay, and we want to make sure that we auscultate before we palpate because we don't want to manipulate any false bowel sounds or any false abdominal sounds of any kinds. Okay, so we're just going to go ahead and I'm going to listen. And we're going to start in the bottom lower quadrant. We're going to start right here at the ascending. We're going to move to the transverse, and we're going to move down to the descending. I wanted to show you personally on me because you possibly can't see Mr. Chaffin when I'm conducting this exam on him. Okay? Okay. I did hear bowel sounds. He is active in all 4 quadrants. However, in the case that he would not be active in all 4 quadrants, we would be listening for 5 minutes for abdominal activity. With this exercise, you can also listen for vascular sounds, listening to the aortic. You can possibly see sometimes on patients the aortic pulsation, and you can also feel it, and possibly you can auscultate it as well. Okay, so I'm just going to go ahead and I'm going to palpate your abdomen, and you just let me know if you have any tenderness or any pain at any time. Okay, and then at this time we would be locating the liver and possibly locating the spleen. Most of the time the spleen is not, you are not able to locate the spleen, and if you should locate the spleen, that is a possible indication for an enlarged spleen, and that is a reason to seek medical attention. Okay, so we're just going to go ahead and we're going to feel for the liver. The liver is actually going to be on this side, on the right side of the patient. So what I'm going to do is I'm just going to verbalize how to locate the liver. We're going to be lifting underneath the rib cage, moving slightly over, and right then you should feel the edges of the liver during your palpation. Okay, and you can follow that edge of the liver from side to side, and just note any hardened mass, any abnormalities to the smooth feeling of the liver. Okay, and so I'm just going to go ahead and put your shirt down. All right, and then next we're going to get started with the lower extremities. Since I already have my patient on a table, I'm going to bring a chair around. And Mr. Chaffin, you can actually sit up if you'd like. And in this exercise, we'll be looking at the lower extremities of the patient, noticing any discoloration. We are also going to note the hair distribution, making sure that that is appropriate for his age and his gender as well. So we're going to be looking for any edema, any discoloration of the skin, and just looking at the overall general appearance of the lower extremities. Looking for symmetry, and sometimes in some cases most of the time for females, they do have more varicose veins than certainly males do, but that would be something that we would want to look for as well. Okay, and so with the lower extremities, we're going to inspect first, and then we're going to be palpating for the popliteal pulses, the posttibial pulses, and the dorsal pedis pulses, or the dorsalis pedis pulses. Okay, and so I'm just going to have you scoot back slightly so I can locate these pulses. And with the popliteal, that is the first one that we're going to palpate today. We're going to be going behind the, actually I'm going to pull this out slightly so I can get behind your knee. And we're going to be locating the popliteal pulses. And we should feel these right behind the knee here. Okay, and so I'm going to measure both of them bilaterally on both legs. And they should be strong and equal bilaterally as well. Okay, and once I have located those, I'm going to go ahead and move down to the posttibial pulses. And with these are going to actually be right behind the ankle. I don't know if you can see, but they're right down here. And once we have located those are actually going to be more towards the Achilles heel. Okay, and once we have located those, we can go to what I feel is the easiest pulse to locate is the dorsalis pedis, and I'm just going to lift my patient's leg up. Okay, can you lift the other one up as well? And right here, we're just going to feel the pulses right here. And those should be strong and equal as well. Okay, and Ms. Chaffin, you can put your legs down for me. Thank you very much. Next, we're going to go ahead and test the range of motion and muscle strength in the hips, the knees, the ankles, as well as the feet. So we're going to go ahead and get started with the hips. So if you could just lay down one more time for me. Just, lay right back. Thank you. I'm going to push on your hip, and you're going to slightly rotate to your left, okay? And so go ahead and rotate to your left, okay? Go ahead and rotate to your right, okay? And go ahead and stand up, or sit up for me, please. All right, and so after we have examined his hips, we're going to examine his knees. I'm going to just have you extend your knees out, just one at a time. There you go. Go ahead and do the other one, okay? And I'm going to have you push out against my hand. Okay? Okay, testing the knees range of motion as well as the muscle strength of the knees. If you could go ahead and rotate your ankle in a circular motion. Okay, and with the other foot. Okay, and can you go ahead and push against my hands? Okay, push out against my hands. Okay, and this also tests for ankle strength as well. With your feet, I'm going to have you push up against my hands. Okay, push underneath my hands. Okay, excellent. So then after that, we have completed our examination of the lower extremities. Next, we are going to continue on with the musculoskeletal portion of this exam. Through the musculoskeletal portion of the exam, we are going to examine the overall joints of the patient. We're going to palpate joints, feeling for any possible previous injury of ligaments and tendons, and we can feel that from the sides of the knees. And we can also examine the joints on the elbows as well, and essentially joints anywhere. You're free to inspect and palpate. So what we're going to do is we're going to have you do a deep knee bend, and so we're going to have you drop your knee, okay, and just bend it out close and then all the way, okay? And then go ahead and do the same to the other one. Okay, and then I'm going to have you stand up and you're going to squat down like a frog. Okay, go ahead and squat. Okay, and then go ahead and you can sit back up here again. I do apologize. We are going to next test for the scoliosis portion of the musculoskeletal exam. So with this portion, I would have the patient have his back towards me, and I would be following down his spine, making sure that there are no curvatures. So that's what I will be doing, feeling for any curvature of any kind. And Mr. Chaffin, I'm just going to go ahead and have you bend down towards your toes. And through this, I'm going to be examining the curvature of the spine, making sure that the spine is nice and even, straight line all the way down to his tailbone. Okay, thank you very much. You can go ahead and stand up. So that also that also examines the alignment of the spine. Next, we're going to test the range of motion with the spine. Mr. Chaffin did bend over. That shows me one side of range of motion. Next, I'm going to have you just bend from side to side. Okay, thank you very much. And that finishes testing the range of motion of the spine. Next, we're going to be doing the Romberg exam of the musculoskeletal examination. With this examination, I'm going to have the patient stand up. And with his eyes open, I'm going to note any swaying, any loss of balance of any kind. He does not, so he tests negative for this Romberg test. But then we're going to have the patient close his eyes. And I'm going to note any swaying, any abnormal loss of balance as well. And he also tests negative for this. Okay? So that concludes the musculoskeletal portion of the examination. Next, we'll be continuing on to the neurological part of the examination, for which this examination I will be using the hammer. So that will be this portion of the exam. If you would like to just put your feet right up here for me. Okay, and we're going to be using the bottoms of your feet, so I do apologize for any irritation that might cause you. Okay, and so for this examination, we'll be using a hammer. For this Babinski reflex test, we'll be using the back of the hammer, so we will be not using the hammerhead portion of the tool, but more of the scalp and the back. Okay, so if you could just lift your foot up against here for me, please. And we are going to start from the bottom of the foot, and we are going to move up. And so what we are noticing for is that the patient's toes should be curving this way. They should not be fanning out and pulling towards him at all. That actually indicates neurological injury to different cranial nerves. So that is what we'll be looking for in both feet. Okay, and then I'm just going to do it one more time, and he does have a correct response to this reflex. And in this examination, we would be testing both feet as well. For the next portion of this examination, we'll be looking at the coordination with the response from his brain to perform different functions. So with that, we're going to do the finger to nose examination. So I'm going to have my finger out here, and you're going to touch your finger to my finger, and you're going to put it to your nose, okay? So go ahead and take your finger and point it to your nose, okay? Again. And somebody, thank you, sorry about that. And somebody possibly with a stroke or cranial nerve injury would not be able to make it back to their nose. They would probably miss. So that is a good way of testing with possible stroke victims as well. So next we're going to do the heel down opposite shin, and with this exam we're going to have the patient put his shin out. So we're going to have you lift this leg, and we're going to put it up against here. You're going to take this portion of your heel, and you're going to scrape it up against your shin. Okay? And we're just going to go ahead and conduct that with the other foot as well, and go ahead and move it up and down. And this tests for cranial nerve injury and function as well. You can go ahead and relax your feet. You can put them down if you'd like. With this last portion of the examination, we're going to be conducting the sensation portion of the neurologic examination. So with that, we will be using the half Q-tip that I have created. Half of the Q-tip is a soft feeling, and the other half is a sharp feeling. And I'm just going to move this on his face and his hands, his legs, as well as his feet, and he will be able to tell me which side is soft and which side is hard, okay? So we're just going to go ahead and you tell me if it's soft or hard.
Soft. Soft. Hard. Soft. Hard. Soft. Soft.
Mm-hmm.
Hard.
Okay. All right, and sometimes with possible stroke victim, they would not be able to differentiate between hard and soft. And with a stroke victim, this also gets harder to differentiate as you move further away from their head. So, such as the legs and the feet, they may not be able to accurately tell you if it's hard or soft as well. Okay. So then next we're going to be doing the deep. With the hammer, we're going to be testing the deep reflexes of the brachioradialis, the patellar, and the Achilles. And for this portion, we will be using the hammer part of the hammer. So we will be using just the head, and we will be testing the brachioradialis, the patellar, and the Achilles. So if you could just go ahead and put your arms out for me like this, okay? And just striking it should allow the arm to have a contraction, just a slight contraction, and you want to make sure that you're just hitting it with the weight of your wrist. You're not really hitting your patient hard in these tender reflexes, okay? So we're just going to go ahead and test these, and you should have a reflex. Okay? Okay, and then I'm just going to have you bend your arm like this, and we're just going to hit the back part of the elbow, and with this I should have a jerking reflex of the arm. Okay, and then next we're going to be testing for the patellar. Excuse me. We're going to be testing right here. Just right below the patella, right where that reflex sits. We're just going to be hitting that slightly. You're just going to actually just bend his knee down like this. Okay? And we're going to be testing that on both sides of the knee. And then lastly, we're going to be testing for the Achilles. In this exam, we can have, we're going to be lifting the patient's foot up like this, and then we strike the back of the knee, and we should be getting a reflex with that as well. And we're going to be testing, in this examination, you would want to test the backs of both elbows, both patellar reflex sites, and both Achilles heels as well. And so that does conclude our examination for today. Different adjustments would be made depending on age and sex as well. I would note that in the chest portion of this examination, if we did have a female, we would want to focus more on our chest areas and question different areas of the breast as far as masses, lesions, adhesions, and lumps and tenderness with the female. We would also want to check that with the male, but with a female it is more common and it is more necessary. So in our examination, we would have palpated the chest, noticing for any tenderness, any mass, because that can also happen to a male. So that is an adjustment that you would make upon the different sexes of your patient. Okay. All right. and do you have any other questions for me, Mr. Chaffin? All right, and that concludes our exam for today. Thank you.